Yeah, and this one cracks me up here. Have healthcare prices grown in the U.S. over time? You fucking think?
Hey, show us that grok stuff before we read this, so we can see comparisons.
Oh, right. Hang on. Let me
This is
go
going to
over
blow your mind.
here. Yeah, I had a little conversation with Grok. It turns out that if you ask the right questions, you can get Grok to tell you all kinds of things. I asked it to compare healthcare costs between 1988, which is when I first became aware of health insurance at all, and now.
Look at the average incomes.
Average income in 88 was 23,000. Now it's 63,000. That's an increase of 174%. Monthly premiums were 217. No, they weren't. My monthly premium was like $20. My monthly premium was like $20 in 1988. I remember that.
Maybe now it's for a family, though.
That might be for a family.
Yeah.
Now it's $2,000, an increase of 822%.
God.
822%. That is straight up fucking usury.
Wow.
Yeah.
All right.
Yeah. Doctor copays were $7. Yeah, I remember that actually. Now they're $37, which is a 400% increase, but that is also incorrect because if you're not subsidized, it's a lot more than that. Checkups or seeing a specialist, it used to be like $40. I remember that. Now it's $150, which is a 275% increase. Is anybody out there has gone to a specialist recently? If you can toss up the amount you paid to go see a specialist on a single visit, I'd appreciate that. You don't have to put that one in a super chat in particular. I'm watching the Rumble side of the house right now.
All right, so you're talking the specialist?
One visit to a specialist.
All right, so we're going down a rabbit hole here.
No, we're not.
Oh, okay.
It's relevant because I don't think that $150 for 2025 is correct.
Okay. All right.
I think it is probably double that.
I mean, when you go to see a specialist, you're going to pay specialist prices.
Precisely my point. That is exactly my point.
Okay.
So overall, healthcare costs rose 4.7 times faster than income inflation. For a family of four with $63,000 income in 2025, unsubsidized ACA monthly premium was $2,000. Oh, this is Obamacare.
Yes.
This is specifically Obamacare. There was no Obamacare in 1988. He was still living in Kenya with his husband, Mike, at the time. Oh, sorry. Did I say that? My bad.
Yeah,
adjusted for 1988 prices, income equivalent 23,000 roughly. Average family premium $217 a month. Okay, he's just adjusting. Grok is just mathematically adjusting here. He's not giving actual numbers. I remember at 18 years old, the hotel that I worked at gave health insurance, and it was $20 a month. And that's it. It was $20 a month.
Yeah.
For basic medical care. Now you could get a more thorough plan, which made sense for the females who were married and might be having children at the time.
Or older people.
Or older people. But for an 18-year-old kid, that was like fantastic. If I needed to go to the doctor, I paid like $5 because I had life insurance.
Look at that. I mean, look at that. I mean, you have your income has gone up 174%, but your monthly premiums have gone up 822%.
Mm-hmm.
All right, that is not keeping up with the market.
Yeah,
you can obviously see the government bump in there.
Yep.
And anyone can do this. You can go to ChatGPT, Grok, any of the AIs, ask the same questions, and you'll get comparable answers.
Listen to me on this. You have to learn to ask your questions correctly. You cannot be vague. You cannot imply. You cannot insinuate. It must be a direct question. And if it has a parameter, you must include the parameter as well. I want to see all health insurance rates from 1988 to 2025, including whatever additional things you want to see. If when you ask these AIs questions to get information like this, precision is everything.
Okay. Yeah, you're right. Precision.
It is what it is. You're literally talking to a machine. So it's not going to go, oh, I think he means this. It does not work that way.
No.
It is a simulation of intelligence. It is not actual intelligence.
Thank God.
Therefore, you have to kind of Therefore, you have to kind of spoon feed it. I'm actually going to not look at that right now. We've got something going on in one of the chats. I'll tell you later. But anyway,
I know we have Hammerhand in the house and
going batshit over there. He's absolutely going batshit. God bless you, man.
Thank you. And we'll get to the super chats at the end. That's how
we
handle business.
We will, but I saw those going by. I'm like, damn it.
Yeah.
Anyway, I asked Grok, insured categorically does not equal serviced. What I mean by that is having health insurance doesn't mean you're getting health care. Those are not the same things. For those individuals purchasing commercial healthcare plans, copays are grossly inflated by insurance companies. Only individuals on EBT or other state welfare programs are able to bypass this problem. That is from personal experience. It's from the law firm I worked at. That's what I'm talking about. Those individuals who entirely exist on government handouts. I saw people who were paying, they got a 2-bedroom apartment for $1,800 a month. What do they pay out of their pocket?
I don't know.
$52.
Wow.
You're paying the rest.
Yeah.
You're paying the rest. There's a whole culture out there that does this. There's
Correct.
a whole culture, thousands and thousands and thousands of them, probably hundreds of thousands.
Like my mother is in a rest home now, and the only reason she could stay there is, I believe, Medicaid. But the thing is she had to surrender a $300,000 whole life insurance policy.
And she's also been paying into it her entire life.
Correct.
Your mother, no matter, I don't know her as well as I should, I suppose.
Well, she was mean. She was mean to you.
What she was mean to me. That's what I was trying to dance around there.
No, you can be honest.
That's fine. That's fine. True. But what I do know is that woman worked her whole freaking life.
Correct.
She worked. And she earned that Medicaid.
Well,
she shouldn't have to surrender a damn thing.
But the thing with Medicaid, Medicare, Medicaid, I don't remember which one. If you have any assets, the government takes them. So literally, like, we signed over her whole life insurance policies. Just so
not for the EBT card holders.
Yes. They get it for free. And and listen, nothing is free, okay?
No, we pay for it.
Well, here's the thing.
You and me, we pay for that shit.
Well, I did 33 years in the military.
Right.
I understand nothing. There is nothing free in this world. And I would say not even love, unless it comes from a dog.
Right.
So, yeah. And it just bothers the shit out of me that there's a whole culture out there who just says, fuck it, and they just leech off the system. That really makes me mad.
Yeah, that's infuriating. That is absolutely fucking infuriating that goes on. Yeah, that was, I mean, it's straight up. I know for a fact that because her store downtown where you and I spent our early teenage years, that was there. When did she start that? In the mid 80s?
Yeah, I would say somewhere in the 80s.
Yeah, because I remember that place.
Yeah, and she fucked up and financed it with credit cards and lost her primary house. Right while I was going through a divorce, and I had to actually move her into my house that I was trying to buy at the time. It was it was a clusterfuck of monumental proportions.
Outstanding. Out fucking standing. So anyway, Grok, I said insured category does not equal service. Grok says valid point. Being insured doesn't always mean affordable service. The ACA Obamacare caps annual out-of-pocket max at $9,450 per individual for 2025 commercial plans. Deductibles average $20 to $25. Visit often higher without subsidies. There you go. Medicaid via welfare like EBT. Medicare, by the way, is partial. Medicaid is everything. Medicare, partial. Medicaid, everything. Medicaid via welfare like EBT typically has a $0 to $4 copays for eligibles. Expiring enhanced credits are inflating costs by 75% on average. Renewals are needed. And then I said, often higher without subsidies. Assume zero subsidies. Now what do copays average? See, you have to guide Grok's hand.
Okay.
Grok, without subsidies, no premium tax credits or cost-sharing deductions. Average copays in ACA Marketplace are $30 for primary care and $55 for specialists in 2024 data. Varying by state and plan tier, higher in the bronze tiers, which is the bottom tier. There's like bronze, silver, gold, and platinum, I think, are the levels. But the thing is, what ends up happening is I'm going to remove that from the stage and add that one to the stage. The health insurance companies are raising their rates, period. We know that they are. We saw the 822%. We just saw it. They continue to raise their rates, and they continue to deny any claims. And you have to literally hire lawyers. The lawyer that I worked for existed because of that.
Yeah.
That firm specifically exists because this exists.
And explain, like, if they win in court, and the person gets a judgment, that judgment goes to the person, and then legal fees are above and beyond that.
Watch Grunt Speak live every Tuesday and Thursday at 8 p.m. Eastern. And if you want to join Pop for Supporter Sundays, go to redonkulous.com/donate and make a monthly pledge. A link is in the Meat Gazer box.